right, thank you very much for all being here tonight. As she said, I'm Stacy Holl. I'm an internal medicine physician at Grand Itasca Clinic. I am originally from Grand Rapids. I grew up here, went to high school here, and then after high school left the state and moved to Iowa for about 14, 15 years, at which point I decided to move back. And so last summer, moved back and have been at the clinic since about September. So. I am in internal medicine, as stated, and most of you probably know what internal medicine is, but it tends to be a little bit older population. My average patients probably run in the 60 to 70 range, and then tend to be people who have more chronic illnesses versus your young, healthy people. I don't do so well with them. So, topic tonight, we're going to talk about insect-borne illnesses, primarily those spread by mosquitoes and ticks. I know we are kind of briefly talking about this, but it's a big topic right now. We're seeing a lot in the media, of course, about it, and we'll talk about Zika virus some. And then, of course, for us in northern Minnesota, we see a lot of tick-borne illness, and it's a very common thing that comes through the clinic. So our objectives tonight, we're going to first kind of understand which insects spread disease and what diseases are spread. There's a lot of them, so of course we're not going to talk about all of them tonight, but just to give you kind of a general sense of what's there. And then we're going to talk about some more common in Minnesota, and luckily in Minnesota we don't actually have that many comparatively to a lot of other places in the United States. But we'll kind of touch base and get a better understanding of at least a few of them, some being the mosquito-borne illnesses such as West Nile virus or Zika virus, and then primarily we'll focus on Lyme disease from the tick-borne side, and we'll touch briefly on anaplasmosis, which are most common here. And then we'll kind of finish up the talk with a little bit of discussion about what can you guys do to protect yourself from these different illnesses, both here in northern Minnesota and when you're traveling to the places that have other illnesses. So this is just kind of a brief table of insects and diseases, and a lot of these again are not in Minnesota, luckily. Mosquito-wise, you've got a whole list of them, and several of them are very difficult to pronounce. And so I'll let you just glance at them. Tick-borne, depending on where you're at in the United States, there's various different tick-borne illnesses. Some are more severe than others. But there really is quite a variety, and it's always good to know when you're traveling somewhere what is prevalent there and what should you be watching out for. And then fleas and body louse also spread disease, but we really don't see any of that here in Minnesota. That's more in the southwest areas, we see a lot more of that kind of stuff. So what insects do not spread disease? So head lice, pubic lice, bed bugs, spiders, and scabies in and of themselves can cause irritation and problems from the bites that they cause, but they don't actually spread like an underlying disease such as something like Lyme or Zika or things like that. So in general, you can't catch anything from them. It's just more the nuisance of having them. So in Minnesota, talking a little bit about mosquitoes, this information's from the Minnesota Department of Health, and most of the numbers, at least for all those but Zika up there, are from 2014. So in 2014, there was 21 cases of West Nile virus, which I'm sure you've all at least heard of, if not, seen more frequently. So really not a lot of cases. Of those, probably only about 6 caused severe illness. The rest kind of caused more of a flu-like type thing that we'll talk about a little later. Zika virus. So this is the most updated number for Zika. It's changing weekly, how many numbers we're seeing. The Minnesota Department of Health and the CDC update these numbers every Thursday, if you're interested. So 21 cases in Minnesota. So far in the United States, none have been locally acquired. They've all been ones that people brought back with them after traveling. And then the only other mosquito illness that we see in really any capacity is the lacrosse encephalitis, and we won't really even talk about it because it's pretty rare. Other than that, we really don't see a lot of other mosquito-borne illnesses in the state of Minnesota. Tick-borne illnesses, so we see a lot more of this in Minnesota than we do mosquito-borne illness. Anaplasmosis in 2014, we had 448 cases, and Lyme we had 896. The important thing to remember about some of these numbers is that there's a lot of cases that don't potentially get reported, both for mosquito-borne and this, if people don't know they have it, if they get treated in more of a just call in a prescription kind of way, something like that, without an official appointment at the clinic. They won't necessarily get reported to the Department of Health. We'll start a little bit with the mosquito-borne illnesses. Up there are 2 different types of mosquito. They have very long, difficult to pronounce names, so I'm not even going to try. The one on the right is the mosquito that carries Zika, and then the one on the left is the West Nile mosquito. And a lot of the distribution of mosquito-borne illness depends on where do those mosquitoes live. And that's why they don't really anticipate in northern Minnesota that we're going to see a lot of locally acquired Zika necessarily, because we don't have those mosquitoes here. Southern Minnesota does, so there's the potential that should enough cases develop, we could see it there, but not up here. So, and then the map is basically an overall picture of where you see a lot of mosquito-borne illnesses, and you can see on there that it's a lot of tropical areas. Is that what gets the bulk of those? And that particular one I think is for dengue fever, which is one of the diseases that's out there. So West Nile virus, this is a map that shows the states that are affected by human cases of West Nile, and the green states are the ones that have human cases. So essentially it's the bulk of the United States. There's a couple states that have reported animal cases of West Nile, but every state has had some sort of activity at this point. West Nile virus typically is an onset after your initial bite of 2 to 6 days, but can be up to 2 weeks. In general, it's a spectrum of disease, and about 70 to 80% of people never have any symptoms from West Nile virus. Those that do have symptoms tend to have a high fever, and so we're talking about 102 degrees, something like that. They can get headaches, vomiting, flu-like symptoms, joint pain, rash. Typically this rash is not itchy. It just kind of shows up and people kind of incidentally look and say, why do I have this rash? And some swollen lymph nodes. A very small portion of people who get West Nile can get neurologic symptoms, so things like changes in mental status, seizures, coma, but we're talking probably less than 1% of all cases that are out there develop these symptoms. It can be fatal, but it's not common for it to be fatal. This is how the transmission for West Nile virus works. It can actually be carried in birds. And so typically the mosquitoes pass it from one bird to another, and that's the primary cycle for transmission. And then humans and horses are incidental hosts, and that basically means that we can be infected, but typically we're not part of the regular cycle where then mosquitoes get our blood and pass it on, that kind of thing. So the question is whether this affects birds. You can see some effect in the birds. There's something they can live with, but eventually they do have some illness. So if you remember way back when West Nile first started kind of showing up, they were doing counts of birds. They'd go look for dead birds and use that as a determinant of where the virus is showing up in the country. So it can affect them, but it just doesn't quite to the same degree that it does humans. And for some reason, the mosquitoes have never really gotten into a cycle of using humans and horses as part of the transmission cycle. Treatment is symptomatic. There's no treatment for West Nile virus at this time. I don't know that we'll ever really see a treatment, mostly because the majority of cases are so asymptomatic. There is a vaccine for horses, so that doesn't do us a lot of good, but it is out there. So, Zika virus. So this is probably one that everyone has heard of and seen lately. This is the most up-to-date map from the CDC on which places have had cases. The darker green states are states that have had more than 7 cases of Zika virus reported. Again, none of them have been locally acquired. The only case that was acquired in the United States was a lab-acquired case of someone who was studying it and accidentally stuck themselves and got Zika virus. Of these numbers, there's about 1,300 people who have been reported total, and of those, there's about 300 that are pregnant. So of course you know that that's been the big thing, and we'll talk about that a little bit more. And then, of course, there's a lot more in the territories, the U.S. territories such as the Virgin Islands, Puerto Rico. The areas more tropical have reported up to another about 1,500 cases in addition to what's in the continental United States. So Zika virus was first known in 1953, so it's not a new virus by any means. However, between 1953 and 2007, there were 13 reported cases. So for some reason, it most likely was never reported, or if it was in very small groups and no one really brought it to anyone's attention. In 2007, there was a couple different tropical islands that had outbreaks, and I believe one of them, when I was reading about it, was saying that approximately like 90% of the people on that island got Zika virus of the 5,000 people that lived there. So it's a very rampant thing that spreads very quickly. It started showing up in South America probably in about 2014 or so, were some of the first cases identified. And by 2016, it was into 33 different countries in North and South America. So that's what we're seeing now, is that the bulk of countries in the North and South America area are affected by it. The mosquitoes that we talked about before primarily only bite during the day, and this is important because that's when we're out, is, during the day, versus mosquitoes that bite that cause malaria tend to bite at night. And that's why when you think about preventing malaria, they talk a lot about mosquito nets on the beds, and that's why. They wouldn't really do as much for this because they're not out at night anyway. This says that millions of cases should be expected. Well, we've already seen actually millions of cases worldwide from it. South America alone has had over 1 million cases. They currently, just last week, started talking about that in South America, they're actually seeing the number of cases decrease. And the reason for it is because so many people have it. So the new cases that are coming out have actually decreased in number, and they anticipate that in South America it will continue to go down, but up here it will continue to go up because we don't have as many people who have already been affected. So here's just a map of the countries that have had cases, and as you can see, it's all of Central and South America. Some of the Pacific tropical islands have been affected, and then the inset there is the Caribbean. So almost all the Caribbean islands have had cases of Zika virus. So the question is whether you get it, do you then get it again down the line? And right now what they're thinking is that there's a certain amount of immunity for a period of time. They're not thinking that it's lifelong immunity, so they're anticipating that for 5 years or so we'll see a decrease in numbers, but then we may see another increase once you get to the point that there's more people that are susceptible. Symptoms, a lot of people don't have any symptoms at all. Again, a lot of these diseases, you'll see a common thread that there's a real spectrum of what people get from it. These people tend to have more of a low-grade fever, so 99, 100, things like that. The rash that they get, and about 65% of people will get fever and joint pain. Almost 90% of people will actually get the rash, and that's actually an itchy rash. So that's one of the signs that you can get, is that you come in with this real itchy rash on you. And then we don't totally know how long it takes to get the symptoms after you're bit, but they're thinking it's within a week is what they're kind of noticing. Transmission, of course, mosquitoes we know are transmitting it. There's new evidence, or a lot of evidence out there, that it's sexually transmitted, which is unusual. We don't see that as much with mosquito-borne or insect-borne illnesses, that they can be sexually transmitted. And just, I don't know if it was just this weekend or over the beginning of this week, they were seeing that it was sexually transmitted from males to females, but now they're seeing the reverse also. So mother to child, you can get it, and that's where we'll get into some of the discussion about the side effects from it. There has not been any cases of it through blood transfusions, but they're thinking that it's likely that it could be transfused by blood, just like several other things that are like this. And then there's some question of whether breast milk would transmit it, although they don't know for sure. The one thing they do know is that when they measure breast milk in someone, the titers of this virus in breast milk, that they're very high. So there is some possibility that it could be transmitted through breast milk. Diagnosis, so they're working hard to come up with some of the best tests they can for diagnosis of it. The ones they have are okay, they're not great just yet. They do recommend that people be checked within the first week of symptoms. Beyond that, it gets very difficult to know if they actually had it or not, and the tests are much less accurate beyond that first week. So at this point, what they're doing is any travelers that come back that have symptoms, they're trying to test within that first week. For pregnant travelers, they're actually recommending, even if you have no symptoms, that you do some testing in the weeks following return from a country that's affected. And they're actually then doing serial ultrasounds for any pregnant travelers. So I don't anticipate that a lot of the women in this room are pregnant and traveling, but I imagine you have children and grandchildren and friends that have family that are maybe questioning this or thinking about it. Treatment-wise, there is no medicine and no vaccine for Zika virus at this time. There is studies going on to look at a vaccine for it, but I anticipate it'll be a while before that is available. Currently, treatment is to treat the symptoms. So the same things we would do for the flu, lots of fluids, lots of rest. One difference is avoiding the mosquito bites. And then currently the recommendation is to take Tylenol and avoid things like Advil, ibuprofen, Aproxin, aspirin, until you've ruled out other tropical illnesses, because things like dengue fever can actually cause bleeding. They cause some hemorrhage, and so before you take pills that make that worse, they avoid those medications. So complications, this is kind of where the most important information is as far as a epidemiology and public health standpoint. The two big complications that we've been seeing are up there. One is that Guillain-Barré syndrome. This is a syndrome, for those that are not familiar, that typically occurs a few days to a couple weeks after an acute illness, and it does not have to be any particular illness, but there are some that seem to bring it on more than others. And what happens is typically you get weakness that starts in the feet and the toes, and then slowly it progresses upwards. Some people never have too many problems from it, all the way to people who have respiratory failure because it paralyzes the muscles of the diaphragm. Most of the time people recover from it, but it's a long recovery, and it takes a lot of rehab and time and energy to recover from it when it's that severe. Right now there's 17 reported cases that they can link back to Zika virus in the United States. So of about those 1,300, 17 people have had this happen, and I don't totally know the degree of how bad those cases were. The big question with the pregnancies is this idea of microcephaly. Microcephaly is essentially a head that's too small for the gestational age and the sex of the baby. So it's not something that we have not seen. It actually has happened in the past, and typically they think we have about six out of every 10,000 born babies have microcephaly in the United States prior to Zika virus, so it's something that was seen. We don't know the numbers at this point. That's, I think, still to be determined, mostly because right now all the pregnant women that have had it are being monitored very closely, and we'll see as they start having their babies, you know, what is happening. The greatest risk they're thinking is in the first trimester right now, but a lot of the information I have seen does not necessarily say it's only the first trimester. And then often it's not detected until later in the pregnancy. So women might not know until they have an ultrasound or you know, other testing that might show it. They are recommending the serial ultrasounds like we talked about, and they're recommending at 20 weeks and 28 weeks or so having ultrasounds to follow this. And then there have been cases of fetal loss because of Zika virus, and that's been anywhere between 6 weeks of pregnancy and 32 weeks. So recommendations that currently are out there regarding Zika virus, and these will likely change over time as we learn more information, but right now they're recommending that anyone who has symptoms, who gets the virus, do pretty much everything in their power to prevent mosquito bites for that first week, especially if they're returning back, even if they're not. But so things like repellents and some of the stuff we'll talk about later, and then also kind of isolating, not necessarily being out in areas that are heavily covered in mosquitoes. And then right now they're actually making the recommendations that pregnant women do not travel to any of the countries that are affected. And I don't know how long that recommendation will stay in place, but I anticipate through the fall for sure. The other recommendations they're making are for family planning. So, and this kind of gets back a little bit to the discussion of how long do they think it lasts in the body. Right now, they're instructing females who have been infected, so had the illness, to wait 8 weeks before conceiving. And then males, they're telling them to wait 6 months prior to having babies if they've had the illness. They're recommending condom use for any recent travelers to prevent the spread, and then contraceptive use for all female travelers and those with male partners that do travel. So they're taking it pretty seriously to try to avoid pregnancy in the setting of Zika virus right now. We're going to move on to talk about some tick-borne illnesses. We're going to specifically talk about deer ticks because that's what we have here. There are other ticks in other places in the country that cause diseases, and wood ticks in other places of the country can actually cause diseases too, but we won't go into those for too much detail because they don't really affect us as much. So this is a map that looks at tick-borne illnesses in Minnesota from 2000 to 2014. And you can see, so the top line is Lyme disease, the middle line is Anaplasmosis, and the bottom line is babesiosis. And there's some year-to-year variation, but for the most part, they're all trending up. So we're seeing increased numbers in all 3 of them. And we'll talk a little bit about that more, but there's a lot of reasons why they think we're seeing a lot more tick-borne illness lately, including things like reporting. There's just more cases reported, and then there's also a lot of change in habitat that's bringing out more ticks. So anaplasmosis, we'll talk just briefly about it. It's fairly common. The map that you can see up there shows the states that are most commonly seen with anaplasmosis. Of course, you can see that Minnesota is in the dark red, which means we're in the top states for it. One thing to point out if you can't read the screen is that the dark red is 3 to 136 cases per million. So there's a pretty good range in there. And then the graph there is fatality rate. So we actually see more fatality from anaplasmosis than we do from Lyme or a lot of the other mosquito-borne illnesses. That being said, that y-axis, the first number is 1. So 1% of cases, we're seeing less than 1% of cases is causing fatality. So it's still not a high number, but it's enough that it calls attention. Like all these diseases, anaplasmosis can really vary. Most people just get some flu-like illnesses, body aches, fevers, things like that. But it can progress to kidney problems, breathing problems, death. The diagnosis of this is based on symptoms and abnormal blood work. And from a doctor perspective, the abnormal blood work is really the big cue. There's some really specific things that we see on the blood work that tell us this looks like anaplasmosis and we should treat you. Because the goal is, as we talked about there in treatment, is not to wait for a test to come back. This is one that should just be treated when you come in. The blood work abnormalities that we do see are things like low blood counts, low sodium, high liver enzymes. So when someone comes in with those things, here, especially in northern Minnesota, we're pretty quick just to treat until we know otherwise. And usually for this, the treatment actually is not super long. The recommendations is 3 days after your fever stops. Most people, I'll tell you, get treated 7 to 10 days is probably the amount of treatment you need for this. Doxycycline is the go-to antibiotic, and that's kind of a common thread for a lot of tick-borne illnesses. We use doxycycline for them pretty commonly. Lyme disease. So this map is from the Minnesota Department of Health, and you can see the high, moderate, and low-risk states, the high being the bright red also. And you can see Itasca County is in that, along with all of our surrounding counties except for Koochiching. So really, probably half the state is pretty well affected with Lyme disease cases. So one thing that's really important to remember about Lyme disease is it is just another bug. It's a bug like pneumonia, like staph infections, like skin infections that people get and we treat with antibiotics. And for the most part, it's relatively easy to treat. This is, of course, the deer tick, and you can see the male and female adult ticks, and then below those are the male and female nymph forms of the tick. The other picture there is the bacteria itself that causes Lyme disease, and it's a spirochete, which really doesn't mean a lot other than typically they're very hard to grow on cultures, so we don't tend to ever culture it to find out if that's for sure what it is. Just a few random facts about Lyme disease that you may or may not have known. It was named after a town. So Lyme, Connecticut is where the first case of this was identified, and that's where the name came from. Most people don't ever remember even getting a tick bite. So I see a lot of people come in who have tick bites, and most of those are not actually deer tick bites. They're usually wood tick bites because those are the ones that people find. Typically, they don't even necessarily ever find the deer ticks. It needs to be attached for at least 36 hours, and some even say up to 48 hours. Typically, you can tell how long they've been attached by how engorged they are. So if you find a tick that's just barely attached, probably it has not been attached very long. If you find one that's embedded in the skin and is kind of fat and blown up, probably it's been there longer. So only female ticks spread Lyme disease, and typically only in the nymph stage, which we see more in the spring and in the summer. And then the adult stages, you can see some transmission, but it's less, and that typically is seen more in the fall. It's not an emergency when you get Lyme disease. If you see that you have a red spot on your leg or you find a deer tick, you can watch it for a day or two and see what happens. And if then you develop something down the line or a week later you develop something, then at that point, be seen to take care of it. Of the people who get a deer tick bite, only about 1 to 1.5% will actually get Lyme disease. So when you think about it that way, it really is not a super prevalent disease. It's just, you know, that we see a lot of it here. So, and then, like I mentioned before, active Lyme disease typically is very easy to treat. There's a lot of different ideas about Lyme disease out there, and typically if someone is having a really hard time treating the disease, it's probably not Lyme disease. It's probably something else that is being mistaken for it potentially. This is the range of the tick that spreads Lyme disease, and that's 1998 versus 2015. And you can see again that it has spread exponentially over that period of time. Northern Minnesota, in Wisconsin, we've seen a lot more. The northeast coast actually has probably 3 to 5 times more Lyme disease than we do. So it's actually much more common in Connecticut and Maryland and things like that than what we even see here. And the reasons why they think this is because of changes in temperature overall, changes in habitat, people moving more into the woods than they used to. You know, it used to be uncommon to live up in northern Minnesota, and now there's a lot more people who come up here to vacation and spend time. And same goes for the northeast coast. So, symptoms. So the big symptom that we always think about is erythema migrans. About 90% of kids who have a Lyme disease will get the rash. Adults, we don't totally know the numbers of who gets rash and who does not. However, for those who do get a rash, only about 30% actually have that classic target lesion look to it. Everyone else just gets kind of a different looking spot. The other symptoms, of course, are fever, joint muscle pains, fatigue, and again, rarely is it ever life-threatening. Lyme disease is a clinical diagnosis, so that means it's based on your symptoms and the prevalence in the area. Early Lyme disease, so if you just had symptoms and you went in to get checked, if we did a test, typically it's negative. So a lot of times you'll find that practitioners won't actually even test it. If you come in with, you know, a nice big lesion on your leg, a big rash that developed, there's no reason why a blood test needs to be done. And then if a test is done, there's actually 2 steps to it. There can be a screening part of it, and then if that's positive, it's sent for a confirmation, and both of them need to be positive for it to be Lyme disease. Sometimes what we see is the first step is positive, but then the confirmatory test is negative, and that is not Lyme disease. So it gets kind of confusing, and it's hard even for, you know, physicians and providers to interpret, let alone for, you know, people who aren't as familiar with that. So something kind of just to keep in mind. In general, the tests for screening are very good. And if you do have a negative, you think maybe you got joint pain and stuff from it, and you got checked within the first week and it was negative, getting checked again in 4 to 6 weeks is reasonable to do. And if it's negative again, then it's pretty likely to be a negative test, but it can sometimes turn it positive a month later. So, erythema migrans, we talked about this briefly, where sometimes when you get a tick bite, it gets bright red, you get a big area of redness and kind of looks rashy, and your question is this erythema migrans or is this just a reaction to the bite? And these are some different tidbits that can help you determine that. Typically, erythema migrans will come up 7 to 10 days after the bite. So if you found a deer tick and you pulled it off and there's nothing there, and then a week later something shows up, that's more likely to be erythema migrans than from the tick bite versus a red spot that's right there right away when you notice the bite. Typically, erythema migrans has no symptoms. It's more of an incidental, like someone comments, what's that rash on your leg, or you look down and you notice it. Whereas the tick bite itself can be very irritating, so it can have itching and pain and some discomfort. And then the amount of time that they increase over and decrease over varies depending on it. Size is usually bigger for erythema migrans, so that can be a little dependent on the size of the person. And then in general, tick bites themselves won't cause fevers, chills, things like that, versus if you have Lyme disease with erythema migrans, you will have some of those systemic symptoms. So this is erythema migrans. Each one of those pictures is it. So in the middle you can see the real classic target lesion. You can also see there's one that has really just central clearing, no actual target look to it. You can get multiple patches, so they'll show up on multiple parts of the body. And then some of them just have more of a reddish look that sometimes even has kind of a bluish, purplish hue to it. So all those are erythema migrans. versus these that are due to other things. So this is a variety of different rashes. So on the top is like an autoimmune rash. And then the one next to it's actually a medication reaction. So things like that can happen. This is ringworm down here. And then that's a baby that has hives. So had a reaction to some sort of food or medication or something like that. So rashes are very difficult to figure out. If you ever have doubt about them, you can always come in and ask. But there are a lot of different ones caused by a lot of different things. So complications of Lyme disease, so they're rare, but they can happen. We can see problems like neurologic problems that occur. Bell's palsy, so for those who don't know what Bell's palsy is, it's paralysis of one side of the face. Can be caused by Lyme disease, and if you know someone who ever had it, they should at least be checked for Lyme disease to be sure that it's not related. Sometimes it's not. Sometimes people just get Bell's palsy on their own, but it can be. There can be heart involvement, although this is rare, and then some nerve problems in the legs, and then of course the big one you hear about a lot is arthritis. Usually it's one or a few joints, and a lot of times they actually get large and swollen like the picture shows. But those are all some complications, and depending on which of those you have, that actually determines the length of treatment that you get. So treatment, 10 to 28 days, and typically we only use it in people over 8 years old because it can cause problems with teeth in people who have developing teeth. Other options, and this is what we use in kids or people who can't take doxycycline, is amoxicillin or the cephalosporins. Prophylactic dose, so this would be if you had a bite but you don't really have any symptoms yet, do you need to be treated for it? Generally not. Most people don't need treatment if they had a tick bite alone. If you do get treatment, it's in the form of one dose, a slightly higher dose than what we normally would give. And typically we think about it for people who had an engorged tick bite that within the last 24 to 48 hours of being seen was pulled off. So say you came in to see me and you said, I had a tick bite and it was engorged and I pulled it off a week and a half ago, there'd be no point at that point of treating you because we're far enough out that we'd know if you had Lyme disease yet or not. Versus if you just pulled it off that morning, then it probably would be worth doing that one dose of doxycycline. So sometimes you'll see doctors maybe be a little quicker to do this. I know our ER does this a lot. If you go in for a tick bite in the ER, they're pretty quick just to give it to you regardless of any of the scenarios. One dose is probably not super harmful, but of course anytime you take medication, there's always some harm. So just being aware of kind of what the recommendations are and what's available out there. So post-Lyme syndrome, so some people will end up with continued symptoms despite treatment. So you go through your full course of treatment, whether that be 14 days or 22 days or whatever it is, and they still have some discomfort. They haven't really recovered from the fatigue yet, and this is referred to as post-Lyme syndrome. There's a lot of contradictory information out there about this, and that is really only a fault of the medical community. There's a lot of different ideas of what it could be and what it's caused by, and more importantly, how we treat it. The recommendation and the thoughts of the Infectious Disease Society of America is that it's not an active infection, that it's a different relation to the way the body works, and it's not really anything caused by the actual active disease. Symptoms typically are fatigue, pain, joint and muscle aches, and right now the recommendation is if you have persistent symptoms, you can go through two treatment courses, and if after 2 treatment courses you still have symptoms, then more antibiotics are not recommended. And the reason for this is because antibiotics have a lot of risk. There's a lot of things that can happen from antibiotics. There's antibiotic resistance, and so continued treatment with antibiotics when you don't have active infection is not a good idea. So they really focus on symptomatic treatment. There's maybe some thought that some of the people who have some of these diseases have an underlying other mechanism of disease that kind of gets brought out by the Lyme disease, and that's why they have it. But overall, that whole syndrome and the people who are affected by it is pretty rare. It's about 1% of the population who get Lyme disease. So if you do get a tick bite, what do you do about it? Use the tweezers typically, because you can get a better grasp of it because they're pretty small. Get as close to the skin as you can and pull it straight out. I found it interesting that they don't recommend things like Vaseline, kerosene, matches, and I always question a little bit why you would do that to yourself, but it's up there, so don't try to burn it off, don't try to, you know, poke it out with a needle. If you do have residual parts, it's usually not recommended to try to get them out, and the reason being is that if they transmitted Lyme disease, it's already done. You know, so if you try to dig out a part, you're just going to end up causing more problems and yourself more pain. And you're not really going to protect yourself from getting the disease anyway. And then when you're done, cleaning the bite and your hands with soap and water. And that's just good technique, I think, regardless of what you're doing. So most deer tick bites we will see are below the knee. We will see some below the waist. And the reason why is because they're so small and they crawl. So they don't jump, they don't fly. So in order to get anywhere, they usually attach to your pants, they attach to your socks, and then they crawl up your legs. So usually, you know, looking around your ankles, the backs of your legs. They also like warmer areas, so they'll go, you know, behind the knees. I see them behind the knees a lot. In the groin can happen. Very, very seldom will you ever see a deer tick on the upper half of your body. Usually if you're finding a tick on your back or your neck, it's a wood tick, because they're the ones, they're bigger and they can crawl a lot more distance a lot quicker. So prevention of all these different things, and this is for tick bites and mosquito bites. There's a lot of different things you can do, and almost all of them are very simple things that we can do to prevent a lot of this. So things like wearing long pants and shirts when we go into the woods is always a good idea to protect you both from ticks and mosquitoes. You saw the picture there of the socks over the pants, and anyone who grew up in northern Minnesota is very familiar with that and doesn't judge anyone for wearing their clothes like that. So you're okay. You know, using insect repellent, and we'll talk about those a little bit, and then eliminating standing water. So all of us have buckets and tires and, you know, different things out in the yard, wheelbarrows that fill with water, and making sure those are all emptied and not a good breeding ground for mosquitoes. Using mosquito nets if you're in high-risk areas. Again, that would be more for diseases that are spread at night, and we don't really worry about that as much here in northern Minnesota. And then a really important thing that you can do is if you do get sick, when you go to see your doctor, be sure you tell them where you've been, what you've been exposed to, because that really helps narrow down what's going on. Travel history is really important when you're talking about infectious disease in general, because there are some very specific diseases that occur throughout the country. So making sure that you cover that and that they're asking you the right questions to go through that. Insect repellent. So these are kind of the most common ones. In general, DEET is the recommended insect repellent to go to. For the most part, it's safe. You can use it in kids that are 2 months or older. The higher the percent, generally we think the longer the duration of use. So it doesn't necessarily do you any good. It's kind of like sunscreen. Once you get to a certain level, you're just not getting any more benefit. Typically, they don't recommend anything above 50% DEET. So sometimes you'll be at the store and you'll see, you know, 80% DEET or 90% DEET. Really, those aren't going to do you anything better than a 30 to 50 would. And usually the thought is 5 to 10 hours, and so that's a pretty good variation. So I'd probably err on the 5-hour side and reapply at that point. Pickardin is another one that's recommended, and again, this gives you about the same amount of spray, and you can just look at the bottle and see what it is. Usually this one's a little bit less smelly than DEET. It doesn't have quite the pungent smell. IR 3535 I don't see used as much. I feel like that's something that probably people who do more forestry and stuff like that are using more. Citronella is out there. It does not do anything for ticks, but it can protect from mosquitoes, but for a lot less duration than the other ones. Oil of lemon eucalyptus, so that is out there, and I see a lot of people who will use it and say they prefer a little more natural thing. I don't know anytime you put something in a spray bottle that it's really that natural. The big thing to know about that one is it's not to be used in kids under 3. And so avoiding that for grandkids, great-grandkids, or other people you know. And then permethrin. So this is a little bit different thing, and this is not meant to be sprayed on the skin. This gets sprayed on equipment, clothes, things like that. And so the recommendation is to, you know, if you're going to be out camping, if you're going to be doing things, maybe spray the base of your tent. When you spray to go walking in the woods, they recommend doing your shoes and your socks. And they actually have shown that you'll have a 70 times less chance of getting a tick bite if you spray your socks and shoes with this. And then it actually will last a real long time. So if you wash your shoes, if you wash your clothes, it will actually stay for several weeks in them, so you don't have to reapply for a period of time. So what I do with with my kids and myself is we have kind of the going out in the woods shoes, and those are the ones that we've sprayed with permethrin, and we'll see if that actually helps or not. But yeah, and that way you're not having to spray every pair of shoes that you own. So lots of options for different things. You can kind of, these days, get your choice of what type of spray, oil or lotion or whatever you want to use. But I do think it's worthwhile. There's a lot of question about the safety and whether we should be applying pesticides and sprays and stuff like that. But when you balance that with Lyme disease and other things, it's always kind of a, in my opinion, worth using this sparingly. So very seldom has there ever been any cases of toxicity from these from these chemicals, and usually it's been when they've been completely overused. The one recommendation they do make, especially for young kids, is not to use a sunscreen that's mixed with insect spray. And the reason being is because you need to reapply sunscreen much more often than you need to reapply insect spray. So if you do that, you're ending up reapplying insect spray over and over, and so that can actually get young kids into trouble. So using separate ones is a better idea. Other recommendations: take a shower soon after you come indoors, and that's to wash off any ticks that might be there. Put your clothes in the dryer on high heat for 60 minutes. Ticks like moist, cooler temperatures. So dry, hot temperatures they don't do well in. Regular checks for yourself, your kids, and your animals. Even if you haven't been in the woods, it's common enough in northern Minnesota that if you have a yard that has some longer grass or near some trees, that you can pick them up even in your own area, and you don't necessarily have to be going out for a hike to get them. You can consider pesticide application to your lawn if you feel that's warranted. If you have pets, dogs, cats, things like that are outdoors, you can get the insect, little ointments that they put on the back of the neck. And then you can use what they call tick-safe landscaping techniques. And this was new to me when I was looking up stuff on here. I had not heard of that. So we'll look at what that is here. So recommendations, basically you kind of create a zone that the ticks don't want to cross. So you kind of have an area that is that kind of beige border around the edge that's made up of things like wood chips, stuff like that. And that kind of protects you more from the ticks coming right up into the yard. The other thing I think is interesting is planting deer-resistant crops to keep the deer away from your yard. Resources, so these are a few things that to go to whether you're looking up any of these different diseases or other ones. The CDC has a great website for all of your insect-borne, travel-borne illnesses. And I would recommend anytime you're traveling, even to places like the Southeast or the West Coast, that you kind of check out what am I going to run into out there, especially if you plan to be outdoors and active when you're in that area. The Minnesota Department of Health has a good site for things specific to us here in the state. So those are some good places for you to be able to go to. So in conclusion, insect-borne illnesses are common here in the United States. We see them regularly, and you guys probably have seen them frequently in your own lives. A lot of the different diseases have very, very similar symptoms across the board, but can vary for each person. And so a lot of times it's not a real clear-cut, it's this or it's that. We have to kind of use some of the signals that we have. Different diseases are found in certain areas, and that's kind of what we talked about with knowing what those areas are prior to traveling. And then if you do get ill, making sure that you give your doctor a full history of exposure. The recommendation of infectious disease doctors is that you talk about travel, pets, bites, sick contacts. Those are kind of the big things. And then whether or not you have a reduced immune system for one reason or another. Those are kind of the important things when we think about infectious disease, which includes insect-borne illnesses. And then there's a lot of simple things that we talked about that you guys can do and to protect yourselves, and I think they're all easy to do, and I try hard to do them myself. Sometimes it's easier than not, but keep working on those to try to keep safe and not get sick. All right, so that's the conclusion. Thank you.